today we are discussing about the treatment of dehydration. Treatment of dehydration based on the severity, and it is classified into three main types. First one is the mild treatment, second one is the moderate treatment, and third one is the severe treatment. Now I am going to discuss about the mild dehydration treatment. So it is defined as the loss of less than 5% body weight in children and less than 3% body weight in the adults due to fluid loss without major clinical signs. So the clinical features of mild dehydration are increased thirst, dry mouth or dry lips, slight decrease in urine output, mild fatigue or irritability, and skin turgor normal or slightly decreased. So this mild dehydration is usually treated at home. First one, by the oral rehydration. The best option is ORS, oral rehydration solution. It contains the right balance of salts and sugars. Here we have to take an ORS sachet and we have to mix it with the clean water. If ORS is not available, then homemade solutions like mix 1 liter of clean water with 6 teaspoons of sugar and half teaspoon of salt. So what are the components of ORS? It contains glucose, sodium, potassium, citrate and bicarbonates and water. So what is the role of these components in the physiology? So glucose, it facilitates sodium absorption via SGLT1. Sodium, it drives the absorption of water and it corrects the extracellular deficits. Potassium, it replaces the lost intracellular potassium. Citrate and bicarbonates, it causes buffer acidosis which is caused by the diarrhea. And water, it rehydration through the osmotic absorption. So how to monitor for the improvement? Signs of recovery. There will be reduced thirst, better urine output and more alertness, no further signs of fluid loss. So now we will understand that what is the treatment in severe dehydration. So first, what is severe dehydration? So it is when the total body water is lost for more than 10%, then that is known as severe dehydration. So the treatment involves medical emergency. So during this emergency, it requires immediate hospital treatment. Intravenous fluids are required like the normal saline 0.9% NaCl or the Ringal lactate solution. It should be given rapidly to restore the blood volume and electrolyte imbalance. So the next, we have to monitor the vital signs and urine output like blood pressure, pulse and the fluid input or output. It should be monitored regularly in order to cure the severe dehydration.
In case of mild to moderate dehydration, especially when the ORS is not present immediately, there are several fluids which can support the dehydration. These includes plain water, which is the most accessible option, but it does not replace the electrolyte lost in our body. So it have to be supplemented with food and fluid that provides both sodium and potassium. The next option is coconut water. It is a natural source of sodium and potassium that is particularly used in tropical regions. It tastes good, so it is most acceptable for children and adults too. Next, clear soups. They provide both fluid and sodium. These are especially useful for adults and elderly people. They also stimulate the appetite. Diluted fruit juice may also provide both fluids and some energy, but they should always be diluted in equal amount to avoid high concentration of sugars which can worsen the diarrhea by increasing the osmotic lead. Sometimes in adults, electrolyte-rich sport juice are also recommended, but these are avoided for children as they contain high salt. In patients, the patient should be kept in a cool and shady environment to prevent further fluid loss. The person is encouraged to rest, wear some loose clothes and to avoid exposure to heat, especially in case of dehydration due to fever or heat stroke. Thank you.
Special notes for ORS. Children use Pedialyte or WHO ORS. Seek medical help if no improvement. Elderly. Dehydration can progress quickly. Monitor closely. Vomiting or diarrhea. Treat underlying cause and replace lost fluids aggressively. The total osmolarity of ORS is 245 milliosmoles per liter. This low osmolarity ORS reduces the risk of hypernatremia, stool volume and vomiting. Advantages of WHO ORS: inexpensive and easy to prepare, does not require intravenous in most dehydration cases, can be used at home or in clinical settings, reduce diarrhea and related deaths significantly.